So today I will be presenting on my nonprofit called Our World's Animals, or my trading name Our World's People, which started in 2018. About me is my name is Gobind Singh and I'm from Downingtown, Pennsylvania, specifically from STEM Academy, and I'm going into 11th grade. Some of my extracurriculars are I'm the president of STEM Academy's Red Cross Club, which has over 35 members. I'm one of the head facilitators of our local Model UN in Malvern, Pennsylvania. And I'm also an established real estate investor in the area of West Philadelphia. For me, my dream goal is to be an orthopedic spinal surgeon, as orthopedics runs through our family. And my nonprofit is Our World's Animals / Our World's People, and my email is listed below. So a little bit of background about Our World's Animals and Our World's People is a trip in 2018. We went to India, specifically in North India, and we just went for vacation as a family. But what I started to notice when we were traveling is that there were a lot of street animals near restaurants, on the road, and people were just blatantly passing through them in their cars. So as you can see, there's pictures here that I've taken in India. You can see specifically the one in the middle. This is the cow's or the bull's home. You can see all of the trash, nothing is kept, and you can see that the bull is weakened. And then if on the right, this was taken at a restaurant. A dog was sitting there, and unfortunately I couldn't take the entire picture, but he was staring at a street vendor who was cooking food, signifying he was hungry. And on the left is a blind cow that Our World's Animals sponsored for 1 year, who was found on the road, deprived of all resources and could not even see. So overall, how is my organization related to global health? Global health and the ideologies of global health is to not only help people, but help everybody in general. So that's why I'm related to global health. And why is my issue important? In India in general, seeing bulls on the road is very common, like even on public highways or anything, and people just brush over it as if it's nothing. And it almost hurt my heart of the fact that I can get up and eat whenever I want. I can go talk to anybody, while these people or these animals are separated from their families and are deprived of everything they have. So here I have a couple of pictures of all the accomplishments that Our World's Animals and Our World's People have done. As you can see, there's many pictures of health supplies or PPE. So to begin with, when Corona hit, I wasn't able to go pursue my animal aspect, which was something I had to learn throughout my journey, that I couldn't do everything that I wanted to do. Hence, I started Our World's People, or as our trading name. And as you can see on the bottom left, my first big task was I created 450 face shields for frontline workers at the cost of 33 cents per shield, which is significantly lower than average costs of face shields, some leading as high as $10. Then, as you can see on the bottom right, yesterday we donated over 1,200 blue masks to Paoli Hospital near my area, as well as 500 face shields. And what I've seen through this is that everybody thinks that just because a hospital is large, it would mean that they have as much resources as they would need for all of their staff. I was surprised when the executive director of Paoli Hospital told me that a lot of times they had to reuse their masks, and a lot of times they weren't able to get everything that they wanted. And this is the same thing with local food banks. As you can see on the top right, we donated over 550 cans to our local food bank. And the people at the food bank have told me the same thing, that every day people come expecting to have things that they normally would have, and because of Corona, they weren't able to get what they wanted. So that's why Our World's People started, because how can global health thrive if the resources that are necessary to humanity are not being provided? And also, as you can see, with the lady with the Doritos box, that was actually at an old folks home. And the old folks home, when I contacted them, said that they were running on 1 mask per week. And many times that was a cloth mask, and they didn't have facilities to even wash those masks. So they were reusing the same materials over and over again, and they were almost in tears when I brought 85 masks to their facility. And overall, for the future, I would like to continue to donate what I've been donating. But what I would also like to do is go back to my roots, which was Our World's Animals. Our World's Animals are so important, and only 1 in 10 dogs have a permanent home. And over 5 million cows in India are homeless because they don't give milk, they're blind, or they can't do any work. And as you can see in the middle, that was my original start where I started with cloth masks. However, they were seen as not as effective as PPE or face shields. Hence, I did 150 of those. And something that I learned from all of this is that although this may sound cliche, to be thankful for what you have, because you would assume that government funded facilities such as the old folks home would have plentiful supplies, even as much as food. However, they were not. They were almost in tears when I've only donated 85. So that really shows that some people were hit really hard in the pandemic, and I think people should devote their time to being innovative with the money that they have. And people that I would like to thank that have made me successful are the managers and executive directors that even gave me their personal phone numbers to talk to about donating supplies. Without them, it wouldn't be possible to know what to specifically donate and to understand what hospitals and old folks' homes are really deprived of. And I'd also like to thank my family at the top for supporting me through all of my endeavors. And I'd also like to thank the Global Health Leaders Conference at Johns Hopkins University.